the lawyer of Leja Kuku Terminator, the man himself, Dr. Bernard Oko Boy.
Thank you very much, Mr. MC. I'll talk to acting CEO. We'll do something about your position. CEO, let's talk after the program. Your Excellency, our cherished Vice President, Dr. Mahmoud Bawumia, the Chief Director of the Ministry of Health, and all other directors, Director General of the Ghana Health Service, other heads of agencies, health sector development partners, friends from the media, our cherished Kolebu staff, clinical and non-clinical. I see some of our nursing students also here, our friends from the media, my brother and friend, PC for Ablekuma South, Honorable Teacher Ago, distinguished guests, my brother Samson Jaba, and the Lightweight team, invited guests, ladies and gentlemen. Your Excellency, it is my absolute pleasure to be here with you to commission this transformative project, the Lightweight Health Information Management System. There was a time, not too long ago, when if you wanted to find a patient's records, sometimes you even needed a flashlight. You needed a good map. You needed to be very tall so that you can look at corners, so you could find a folder for a patient that needed medical attention. Your Excellency, it was like playing hide and seek with paperwork. And if you are lucky and you find the record, sometimes understanding or deciphering the handwriting of the physician is another challenge. But today, we are all here to say goodbye to those days of the folder. We are saying goodbye to the folder era. Your Excellency, we are entering the era of data, the era of digital transformation. Your Excellency, using folders was always a reminder that we were about 40 years behind the rest of the world. And why do I say 40 years? If you go to the UK or any developed country, they also used folders some years back. Kolebu was built in 1923, almost 100 years ago. When we were using the folder then, the British were also using the folder. But in the early 80s, they let go of the folder. We held on to the folder until you and your boss came around. And we are happy that the folder era is gone. Your Excellency, as a practitioner, I just want to be very down to earth and mention some of the serious problems we had with this system of waiting for a book before you see a patient. One of the sources of trouble or infection in hospitals is nosocomial infections, hospital-acquired infections. And one of the routes or vehicles for transmitting infection from one person to the other in the hospital is the folder. Because everybody is touching it. From the records, everybody touches it. You go to the emergency, everybody touches it. They hand it over to you, you also touch it. From there to the lab, everybody's touching, and it's picking all kinds of materials till it gets to the pharmacy. So the folder itself was a problem. It was an agent of infection transmission. And we are happy that we have digitized and moved away from this age-old transmission vehicle. We thank you, Your Excellency, for inspiring this transformation drive. Your Excellency, apart from the infection, folders were also unfortunately tools for extortion. If you've been in a district hospital or regional hospital before, some people come, they are in a hurry, they are very sick. And so sometimes, it's not all the time. Some, if you they say mensa woman. Some very wild, I call them wild people, sometimes they are not even hospital workers, they are around the hospital records. They can tell you if you have some money, they can get your folder right now. And so, ordinary Ghanaians sometimes are taken through a lot of frustration just for them to get their folder and for the doctor to see them. We want this country to develop, but these are the little things that tell us that we too, we day in this world, we've also come of age. Your Excellency, I watched TV some few years ago. I will not mention the station. And a journalist was saying that his dream is that Ghana will get to the place where when you go to a hospital, they will not wait for a folder. They will just type on a laptop or computer and then all your details show. And I called into the station and told them, you don't have to go far. Come to Kolebu here. It is happening. And the journalist was shocked. And so I'm very happy that we are here to let the world know that we might have a few challenges, but there's a lot that as a family we have achieved in Kolebu and beyond. Your Excellency, your leadership has made it possible for us to take healthcare into the digital age. You saw the need to bring healthcare services up to speed. And instead of just tweaking things here and there, you said, let's give this thing a serious upgrade. Your Excellency, not a reset, a very serious upgrade. And that's what we are doing here. We are here to give the system an upgrade. LIMS is going everywhere. We are not just talking about hospitals in big cities. Every district hospital now in this country has been connected to the LIMS or light wave system. And because of this, we have seen an improvement in many areas. Your Excellency, we are talking about 21 million individuals. 21 million Ghanaians now have their data captured in the LIMS system, almost half of the population. 62% of the country is covered on this system, and we are working hard to make sure that the coverage becomes 100%. Your Excellency, there are many advantages. I will not bore all of you with advantages. But one very important advantage is that you cannot mix two individuals because their names look similar. Your Excellency, there are many Kwabena Jemfis in this country. And the reason why sometimes you hear in the news that they cut, I don't want to use medical terms, they cut someone's leg through surgery when it was not supposed to be the person, is that possibly their name looked just like someone else. But with electronic records, no two records are the same. No matter how close the names are or how similar the individuals look. And these are some of the very important advantages of going electronic with our records system. Your Excellency, it also helps physicians or medical staff to do the right diagnosis early. If you have a woman who is coming from Kumasi, is in Accra, and has a very bad fever, and you don't have their records, you would go round and round and round before you find out what is happening. But with this light wave system, if you key in the ID, all the woman's records at Konfanoche or Suntresu will show up in Kolebu here. And you will be able to tell that this is a woman who had miscarriage some few weeks ago, and so probably has some sepsis from the process. Your Excellency, there is serious transformation happening, and it is my prayer that all of us will see this transformation. Your Excellency, some private facilities have approached me that it looks like only the government facilities are enjoying. And so they say I should talk to you, since you are the digitization boss. They said I should plead with you so that government can cover all facilities and help them to also go digital like we have done with the public sector. It is my prayer that we support them, because whether private or public, health is health. And that is what we are working for. To everyone who made this happen, from our partners to our staff here at Kolebu, to the Lightwave team led by Samson Jabba himself, to our technical team at the Ministry of Health, to our friends at the Ghana Health Service, to all those who made this possible, including my predecessor, Honorable Kweku Ajimamenu, who put in a lot of effort, to our inspirational Vice President and the next leader of this country, Dr. Mahmoud Bawumia. And I want to say, I mentioned Dr. Bawumia's name because when this project came up, some people said the money, because it came with a cost, it was not necessary. But Dr. Bawumia insisted that the way to go is to do electronic database. And so I'm happy that despite the cost, Ghana has paid for it, and we are all seeing the benefits right here at the community church. Your Excellency, some thought it was too early to do away with folders and that it was not possible. But we have all seen that when we come together, it is always possible. Ladies and gentlemen, I want to thank God for giving us a visionary leader like President Nana Addo Dankwa Akufo-Addo, who always says that anything being done in other countries can be done right here in Ghana as well. And for Kolebu, I want to assure you in particular that we will continue to work with this hospital so that this hospital becomes the best in the African continent. We are going to work with you to do that. God bless the team at Lightwave. God bless all our health workers. God bless our senior brother and inspirational leader, Dr. Mahmoud Bawumia. God bless our homeland Ghana and make it great and strong. I thank you very much.